Hello, my name is Carlin Luby, and this is my presentation for week 9. I just have this one note card here, and there is nothing on the back. Okay, so for this presentation, I'm going to be talking about chronic renal failure syndrome. Chronic renal failure syndrome is a pretty common problem, and patients will typically present with a wide variety of issues based on where they're at with the progression of it. But as we know, a syndrome is really a compilation of signs and symptoms that a patient can present with. So typically early with chronic renal failure syndrome, we will have patients that come in and they start complaining of foamy urine. They may also come in starting to complain about changes in their urine output. So maybe they're peeing a ton, or maybe they really have low urine output. This is because chronic renal failure syndrome really changes the fluid balances within your body. They might also come in complaining that they're really tired. Chronic renal failure syndrome messes with the electrolytes within your body, and that can cause a lot of fatigue. You might also be experiencing this fatigue due to anemia that can develop with chronic renal failure syndrome. Additionally, we have patients that come in that are complaining that they have dry, itchy skin. That's because your body has diminished sweat and oil glands. You might also develop phosphate crystals in your skin from high phosphate levels in your blood. We might also have patients that come in complaining that they are nauseous, or that they have a loss of appetite, or that they've lost a lot of weight and they really weren't trying to. This might be because they have a metallic taste in their mouth from uremia. Additionally, as the disease is progressing, things are going to change and develop further. So you might come in and you're saying that you have trouble concentrating now. Maybe your electrolytes are really off. When your sodium levels are out of whack, you can have a lot of issues with your brain. Then you might come in and you might start to notice that you have numbness in your extremities. Maybe you're developing neuropathy. Or maybe you're starting to notice that you're really very puffy. You're starting to retain a lot of fluid. Maybe that's in your extremities, or maybe it's in your lungs, and you're starting to really feel very short of breath when you're trying to do any kind of physical activity. Unfortunately, like I said, chronic renal failure syndrome is very progressive, and the signs and symptoms that patients come in with, can develop and change in severity as time goes on. But typically, in order to diagnose this, we call it chronic renal failure syndrome when you have damage to your kidneys, or when your glomerular filtration rate is less than 60 mLs per minute over a 3-month time period. So it needs to be an ongoing problem in order for this diagnosis. But again, people are coming in because they're having a buildup of nitrogenous waste within their blood. They're having these fluid imbalances, the electrolyte imbalances. They're developing anemia or coagulopathy problems. You might also have issues with your acid-base balances, or you're developing skeletal disorders due to low calcium. Then it's leading to other problems with your cardiovascular system, your GI tract, your neuromuscular system, and you might even develop sexual dysfunction from it. It is just a really wide variety of signs and symptoms that develop due to chronic renal failure syndrome. But chronic renal failure syndrome is not the only problem that can develop in the renal system. There are a lot of other problems, including acute renal failure syndrome. So the difference between chronic and acute renal failure syndrome is really that with acute renal failure syndrome, you are developing fluid and electrolyte imbalances much more quickly. The onset is quite rapid. But luckily, with acute renal failure syndrome, often these issues are reversible. Then the renal system can also develop nephrotic syndrome. And nephrotic syndrome is different from chronic renal failure syndrome. because it is actually an increase in the glomerular permeability within the kidney. So patients start to develop just massive proteinuria where they are really just dumping tons and tons of protein in their urine, and they are developing low albumin levels in their blood because of it. And when you have low albumin levels in your blood, you're not holding fluid in your vasculature, so you're developing a lot of edema. So typically patients start out by complaining of dependent edema, and then it develops into more generalized edema. Additionally, with the renal system, we could see obstructive urinary syndrome, and with obstructive urinary syndrome, it's different because you actually have a blockage somewhere along your urinary tract. So it can be anywhere from the renal pelvis all the way down to the urethra. But a lot of different things could cause this. You might have a tumor, you might have a kidney stone, you might have scar tissue somewhere in there that's causing a narrowing and impeding the urine from getting out. And again, the severity of this can also vary based on what the problem is. But back to chronic renal failure syndrome, there are several diseases that are included within this. Type 2 diabetes and hypertension are really two of the main factors that cause chronic renal failure syndrome. With type 2 diabetes, we know that high blood sugar levels will lead to problems with your vasculature. So the kidneys really just get destroyed and lose function with chronic high blood sugar levels. Then with hypertension, when your blood pressure is high, your blood vessels are constricted, and often your kidneys are not getting the blood flow that they need. They're not being perfused, and therefore the nephrons are starting to die off, causing chronic renal failure syndrome. But those are not the only two causes of chronic renal failure syndrome. You could also, unfortunately, have hereditary problems that lead to it. One thing that could lead to it would be polycystic kidney disease. With polycystic kidney disease, you develop these fluid-filled sacs or cysts on your kidneys, and they start to grow and they start to cause more problems, and they lead to damage and dysfunction within the kidney, which is really unfortunate. But like I said, chronic renal failure syndrome is a very progressive problem, and patients present with a lot of different signs and symptoms, really based on the severity and where they are at and what their experience is. But it's important that patients recognize that they have these problems and seek treatment and try to slow the progression and really try to get the symptoms to a point where they're tolerable so that they don't end up with complete kidney failure and end up on dialysis, because that is just not a good place to be. But anyway, that concludes my presentation for chronic renal failure syndrome. Thank you.